Hi, my name is Emmanuel Cruz Carrasco. I'm going to read chapter 25, Mental Illness, of the textbook Professional English Used in Medicine. I'm going to begin reading the theory of the chapter. A. Psychiatric disorders. Psychiatric disorders can be divided into organic and functional. Dementia is a mental disorder due to organic brain disease. The commonest form of dementia is that associated with old age, senile dementia. Disorders in which there is no obvious pathology or anatomical change in an organ are termed functional. These are described below. B. Substance abuse. Abuse of a substance means using it in a way that is harmful. The commonest forms of substance abuse are alcoholism and drug abuse. C. Affective disorders. Here is an extract from a medical textbook. Affect and mood are similar in meaning and refer to the emotions, for example, happiness or sadness. Affect tends to be used for temporary emotions and is expressed through manner of speaking, facial expression, or behavior. Mood is used to refer to a more permanent emotional state. The most common form of affective disorder is depression, the symptoms of which are poor appetite or significant weight loss, sleep disturbance, for example, insomnia, inability to sleep, fatigue, loss of energy, psychomotor agitation, excessive movement and thought, or psychomotor retardation, slowing of movement and thought, loss of interest in stimulating activities, decreased ability to think and concentrate, feeling that one is of no value to others or that one has done something wrong, recurrent thoughts of death or suicide. 5 or possibly 4 of the above symptoms occurring nearly every day for at least 2 weeks constitute a major depression. D. Neurotic and stress-related disorders. An example of neurotic disorder is obsessive compulsive disorder. An obsession is an idea that is so persistent that it interferes with the patient's life. A compulsion is an obsessive idea that forces the patient to act even though they recognize that it is unnecessary. A common form of this is compulsive washing of the hands. Stress is a feeling of being unable to cope. It can lead to anxiety or fear of problems. A sudden attack of anxiety is called a panic attack. E. Other types of functional disorder. These include behavioral syndromes associated with psychological disturbance, such as eating disorders, disorders of adult personality and behavior, for example, personality disorder, mental retardation, delayed mental development, schizophrenia, and other disorders in which there are delusions, false beliefs. Now I'm going to read the exercises of chapter 25, Mental Illness. 25.1. Complete the table with words from A, C, D, and E opposite. Noun, affect, adjective, affective. Noun, anxiety, adjective, anxious. Noun, behavior, adjective, behavioral. Noun, dementia, adjective, demented. Noun, disturbance, adjective, disturbed. Noun, suicide, adjective, suicidal. 25.2. Make word combinations using a word from each box. 2 words can be used twice. Look at B, C, and E opposite to help you. Now I'm going to read the boxes. These are. Sorry for the video being mirrored. Text box 1. Behavioral, eating, major, mental, personality, psychomotor, sleep, substance. Now I'm going to read the second box. Abuse, disturbance, retardation, disorder, depression, syndrome. Now I'm going to make the word combinations. Behavioral syndrome, eating disorder, major depression, sleep disturbance, psychomotor retardation, substance abuse, mental retardation. 25.3. Complete the sentences. Look at A, C, D, and opposite to help you. 1. The way a person behaves is his or her behavior. 2. Persistent emotional state is a mood. 3. A sudden attack of anxiety is a panic attack. 4. The form of dementia associated with aging is called senile dementia. 5. A disorder which is not associated with pathological changes is functional. 6. An idea which forces a patient to repeat unnecessary actions is a compulsion. 25.4. Which symptoms of depression was this patient suffering from? Look at the opposite to help you. Case 41. A 56-year-old woman presented to her GP or general practitioner complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. Now I'm going to read the symptoms of depression that the patient was suffering. She had lost interest in most things. She was sleeping poorly and tended to wake up early. Those are the 3 symptoms that the patient presented to the GP. Now that was chapter 25, Theory and Exercises of the textbook Professional English Use in Medicine. Thank you very much for watching this video, and that was the video.